Professor, welcome to In Conversation.
Hello, good evening.
Do we need to have the fourth shot?
Well, it's a good question, but to be honest, we do not have, a lot of information, but we did a study in Israel, in my hospital, as well as in the general people that got the second booster. What we have seen is that the second booster, so-called the fourth vaccine, gives you a 50% protection, reduces the possibility of being infected with the Omicron in 50%, half of the risk. And of course, if you are talking about a severe disease, this is much more higher than that. So indeed, in my view, in order to reduce the number of cases of Omicron infection as well as severe disease, a second booster is very, very effective. And I'm all for that.
Okay, so you're saying that at least the preliminary data seems to be showing that the second booster or the fourth shot does actually have a significant impact in terms of protection. When, though, should we be getting that? How soon after the third? Do we wait several months, 3 months, 6 months, 8 months? That's too long, probably.
We have done that up to 4 months and more after the third shot. So I would say that the effectiveness of the first booster, the third shot, after 4 months is reduced. There is a waning of the effect of the vaccine. So indeed, people after 4 months, and of course 5, 6, or more than that, have to gain from another booster. And this is what I'm preaching for. This is what we should do. And in Israel, I believe that the number of severe cases, people admitted to our internal medicine department with corona, are reduced. The number is reduced due to the fact that around 600,000 of Israeli got a second booster.
What do you think of people who say that too many boosters will, in the end, actually be bad for us?
I don't believe that. Scientifically, I don't believe that. We know that in order to fight viruses, of course, epidemic, but also in an endemic dynamic, we have to get vaccines. Sometimes we are doing that annually. So is that harmful? No. In my scientific translation of the facts is that this is the way to go, and this is the way to protect us from a severe disease.
Should we then get used to having these regular boosters? That's what you're implying. Is there any chance, though, of jab fatigue, as they're calling it, even for people who really believe that vaccines are good, that we just get tired of having these additional jabs?
You know, we are doing that with influenza annually. Each year, a lot of people around the world are getting influenza shots. And this is in order to reduce the number of cases of severe influenza during winter time. There's no fatigue in that. There is a theory about that, but we have to balance the risk and the benefit. And in my view, the benefit is much higher.
Is Omicron an opportunity or a threat?
You know what? You can look at that as a kind of an opportunity because it reduces the terminal effect, the severe effect of the pandemic. Of course, it's still a virus. It still will create severe disease in a much lower rate. But looking that on the overall, on the big picture, on the macro picture, on the evolution of the virus, the Omicron is good news, mainly comparing that to the Delta variant. So if we look at the net effect, I would prefer that there will be no Omicron or no Delta. But between choosing a Delta and Omicron, the Omicron is good news.
Some have even said that it could be the variant that the world has been waiting for. Mr. Fauci, who is the medical advisor to the US president, he's actually said that possibly this could even mean that many of the pandemic restrictions could even be lifted in a couple of months, for the US at least. Do you think that will happen for the rest of us?
Yes, indeed. I believe that we are together vaccines and this variant, the Omicron, which is highly infectious, very transmissible, and with low rate of severe disease, the combination of billions that have taken the vaccine with billions that will be exposed and be infected by the Omicron altogether allows us, it's an opportunity to do really what Fauci is saying, to get out of the pandemic into an endemic dynamic of this virus.
What is the worst case scenario? What if Omicron isn't the last nasty variant, but something worse comes along?
You know what? This could happen. I cannot exclude that. But let's face the good news even in that scenario. We have studied Corona. Our healthcare system around the world, in any country, have been trained, hospitals, emergency rooms, ICU, Corona department, have been trained to deal with this virus. We are not naive, we are trained. So we will do better. Of course, we can go ahead with another vaccine. We can go ahead with another medical technology. So on the worst case scenario, of course, there could be a very deadly variant, but it will face a very trained healthcare system around the world unite to fight it. So I'm not afraid, but I will be prepared.
Does this mean that we can open borders? Israel slammed the door shut very quick when Omicron came. Now, though, if we look at the numbers, Israel still has some pretty frightening numbers in terms of severe cases. So is closing the borders a good solution?
No, in my view, it's not a good solution. You can use this tool in a very limited way. You know, we are a global world. We have transportation. People are going in between countries. Commerce, economy, education, tourism. So we have to go back to normality, open borders. This is the way to go all around the world, especially in Israel. And I'm saying to the Israeli government, there were 2 or 3 weeks where closing border at the time of the arrival of the Omicron was effective. It makes sense. No more. We have to open that and to make normality in the way that our people are moving from one country to another. And this is a lesson to all the world.
What about places then like China, the big countries who say, hey, if we can keep our doors closed, we still have enough of an economy internally to just keep things running? Is that, though, a possible solution?
No way. No way. Not for China, not for any country in the world. We have to understand we have chosen a way to live in this world. We have to exchange, transportation, people coming and going. You cannot close yourself for, entirely. And this is taking a lot of energy. Look what's happening now in the Olympics in Beijing. It takes a lot of energy, and you are losing a big part, a dominant part of the way that we, choose to live. We want to visit the Winter Olympics. We want to exchange, tourism. This is the way to go in any country in the world. Omicron is giving us an opportunity with vaccine to return back to the way that we used to live.
They've called Israel a trailblazer. You were part of that in terms of how you've handled the pandemic. So if you are a trailblazer, Israel is a trailblazer, you're going to cross the finish line sooner than the rest of us. What is that finish line going to look like?
In my view, the finish line is going to look more or less like influenza. We will have to confront Corona as another virus in the viruses that we are fighting and facing each year, all around the year. We have to acknowledge that. We have to live our life, of course, using vaccines and using a kind of a behavior that will reduce the possibility of getting either influenza or Corona. Of course, more and more protection for the elderly and for the chronic patient with chronic diseases, but still normal kind of living. People will wear masks more than the usual. No more social distancing, in my view. And it will be gradually and be different between one country to another. But we want to set a courageous example to the world. We can turn back to normal a kind of living. We will acknowledge and understand that Corona will be all the time another virus around us, but still with resilience, go ahead to normal living.
Normal living means no more masks, big parties, big sports events. Those will become part of our life again?
In my view, yes, indeed. No more mask, but some will wear, but it will not be mandatory at the time being. We are reaching to that point. It will take a process, but we will go over that process, and still there will be many people that will choose to stay with mask. That's okay. Maybe it's a good thing for people with risk factors, but on the general, normal, even without masks.
If we look also at things like whether we're going to be wearing masks and all these various aspects, does this mean that there's going to be, though, a two-tier world between the world that is vaccinated and the world that is not vaccinated? Here in Southeast Asia, we have very big differences in vaccination. How do you think that we can go forward when we have these very big differences in vaccination, and yet we are living very close together and we trade very much with each other?
That's tough, but I think gradually the diversity will be limited. It will take time, but we will reach some kind of lower diversity. The difference will be not so extreme as we see it now. So I'm saying gradually we will live in a way that the differences between countries will be limited.
From your time as what you've been called the coronavirus czar at that time, is there anything that you would say to health agencies other people that you know, colleagues in a way, is there any advice that you would give, something that you regret not doing?
You know, the most important lesson that I have here is speaking honestly, transparently, closely with your people, with all the people, putting all the data, all the knowledge, all what you think, all things that you want to go ahead with, put that as transparent as you can, mostly to the public. Talk with them, level with them, and this is the most important thing. In my view, this was the key. You know, I'm very open, I'm very transparent, I'm very honest. The people of Israel put their trust in me because I was honest. And they still now look at me as the Corona project manager that gave them and told them the truth and was all the time for them. This is the most important lesson. And I regret only one thing. It is very, very tough to reach very diverse communities. In Israel is the Orthodox and the Arabs. You have to do whatever is needed, all efforts in order to speak their language, to be closer to them, to understand that there is some mistrust. You have that in many other countries. Your population is not unified. There is diversity. When you are speaking to the public, remember, a part, sometimes a huge part, do not follow you. Go to them, find ways, find their opinion leaders. You cannot be sure that if you are talking in your language, everybody understands 100%. This is my lesson.
So you don't believe in mandatory vaccinations?
Indeed, no. I do not believe in that. You know, we choose to live in a liberal, democratic society. There are prices. And one of them, you do not make it mandatory to get some kind of a healthcare treatment. In my view, you have to do your best to explain, to give the knowledge, to educate. Go and do whatever is necessary in order to bring and to persuade. But then respect the people that say no, I choose not to. Yes, you can give and you can motivate, but my line draws where you are stepping that and when you are crossing that and making it mandatory. In my view, you should not do that with any kind of medical treatment.
Would you like to put a date on when you think that life can go back to normal? I know it's a tough one, but that's what every single one of us wants to know. When will we be able to go back to a life that may not be exactly as it was before the pandemic, but close to it?
You know what? I believe through 2022, the 2022 is a year of a change. Gradually, Omicron will continue to be dominant through 2022. I believe there is a possibility of another variant, but there is a lot of doubt whether another variant can overcome Omicron. So I believe gradually 2022 is the year of a change. Going through the end of 2022, maybe we are changing into an endemic dynamic of this pandemic.
That would be wonderful. We must very much hope so. What is the thing that we as human beings, normal people, not professors like you, what can we do to speed everything up, to make this pandemic, so to say, go away?
We just have to persuade our people to get the vaccine. We just need to keep our beloved and elderly and people with diseases out of being infected. And we have to look ahead with hope to the future. We have to be optimistic and to plan our new life with Corona in a way that we will adjust to a different normality but still normal.
Professor, thank you very much for being on In Conversation.
Thank you so much.